Welcome to SCAI 2022. I'm Dr. Megan Coylewright. I'm the Director of Structural Interventions in Chattanooga, Tennessee at Erlanger Health System. And today I have with me Dr. Devi Nair, who's a global expert in electrophysiology. She's the Director of Electrophysiology and Research at St. Bernard's Medical Center in St. Jonesboro, Arkansas. And she's been asked to come to SCAI to lend her expertise in left atrial appendage closure. Welcome, Dr. Nair.
Thank you, Megan. This is an honor to be here at SCAI this year.
So Devi and I are friends, colleagues, we do research together, and we're really passionate about talking about the safety of left atrial appendage closure. It's important to us that patients have options, and at times we focus on how things have changed in order to increase safety. You know, there's new imaging modalities for left atrial appendage closure. What are your thoughts on that, Devi?
It's a great question. I think what we have to remember about left atrial appendage closure is that it is an elective procedure. It is almost a prophylactic therapy to prevent stroke in patients who are at high risk of having stroke with nonvalvular atrial fib. So it is of paramount importance that we provide this therapy very safely. At the same time, we have newer technologies, whether it's with the devices, whether it's with imaging modalities that help us deliver this therapy much more safely as well. So talking about imaging, we have kind of moved over to using a lot more intracardiac echo, mainly not just two-dimensional intracardiac echo, but also three-dimensional and four-dimensional intracardiac echo in implanting left atrial appendage closures. And the advantage, obviously, is that you are eliminating transesophageal echo, which can add to, safety concerns, can add to general anesthesia. So those are things you could eliminate out of the procedure.
We had new data come out from our LAO registry looking at tens of thousands of patients. We call it the SURPASS data, who'd had Watchman Flex. And the risk of complications was so low, 0.3% after implant. Now, you just got back from Heart Rhythm Society. What were some of the discussions around the role of LAO in stroke prevention there?
So I just completed Heart Rhythm Society meeting, and we had a phenomenal debate between Dr. John Mandrola and Dr. Vivek Reddy regarding left atrial appendage occlusion therapy in general, whether it does have a role in patients with nonvalvular atrial fibrillation. And I would say I'm a strong proponent of the left atrial appendage closure therapy because I think this is one of those therapies that has really changed how I treat my patients with AFib. There are very, very, I would say, minimal number of patients that would actually come back and tell me, oh, I'm sorry, Dr. Nair, that I had to have a Watchman device or an amulet device. They are thankful that they are not on a blood thinner. And unless you take an oral anticoagulant and have issues with oral anticoagulation and still live with the fear of having a stroke, you cannot say that this therapy does not have a role in management of nonvalvular atrial fib.
Yes, I hear in that comment highlighting the patient voice and their preferences, and the two trials that are ongoing, Champion AF and the Option trial and others, are looking at the role of left atrial appendage closure in new ways so that patients do have new options in front of them. I think one of the neat things about our partnership is left atrial appendage occlusion is one of the unique procedures that is done by both interventional cardiologists and electrophysiologists. Tell me a little bit about your thoughts in that partnership and how it's driven the field forward.
Oh, I think it's the beauty of this therapy is that we have two different specialties that have two different technical expertise that have blended the most safest of approaches together and made this therapy much better than what it was in 2004. In 2022, this therapy can be delivered in a much safer, much efficient manner to any kind of patient, whether you are, whether you have significant comorbidities or not. The blending of the two technical expertises has made this therapy extremely good.
Well, on behalf of all of us at SCAI, we're honored to have you at our program and to learn from you this year at 2022. Thank you.